Hello, my name is Rishik Devana.
I'm Ritik Devana.
I'm Alekhya Doddapaneni.
And I'm Surabhi Fadnavis, and this is our presentation on breast cancer awareness.
So, what is breast cancer exactly? Breast cancer is a mutation in the breast cells. This happens when normal cells exponentially replicate more than needed in the breast tissues. In early stages, this can be portrayed as calcification, which then increases in size.
Stages of breast cancer. Stage 0 is called in situ. It's found when cancer cells are found before they're given the chance to break through the basement membrane of a duct to become invasive. Stage 1 is when the tumor is less than 2 centimeters and has 0 lymph nodes. The most common treatment is surgery, but radiation, hormone blockers, and chemotherapy may be used. Stage 2. Stage 2 is when the tumor is between 2 and 5 centimeters, still with 0 lymph nodes. Treatment options include surgery with radiation, hormone blockers, and chemotherapy are more common during this stage. Stage 3. Stage 3 is lymph node positive. This happens when the cancer has spread from the tissue into the lymph nodes, which are usually in the underarm. Surgery is imperative, but radiation, hormone blockers, and chemotherapy is based on tumor biology. Stage 4. Stage 4 is called metastatic cancer. Stage 4 cancers are when the cancer has traveled to a different part of the body. Most common are the lungs, bones, brains, and liver, or distant lymph nodes.
So, these are the common risk factors. Out of all the risk factors, 20% is influenced by genetics. Genes like the BRCA1 and the BRCA2 genes increase the likelihood of developing breast cancer. Different ethnic groups also contribute to the development of breast cancer. Ashkenazi Jews are more prone to mutated genes that cause the development of breast cancer, and African Americans tend to have it more aggressive. Being overweight can lead to a higher risk of getting breast cancer. If you have a healthy diet, daily exercise, and you consume high fiber proteins, this can prevent or slow the spread of cancer cells. When you consume alcohol, it increases the risk of breast cancer by 7 to 16%. Drinking alcohol can also increase the estrogen content in the body, which then also is contributed to the development of breast cancer. Women are 100 times more likely to develop breast cancer due to higher levels of estrogen. Some people's bodies don't make enough progesterone, leading to what is called unopposed estrogen. Without progesterone balancing influence, estrogen can work overtime in your body and cause cells overgrowth. Like tumors, women under 30 have a higher risk of getting breast cancer if they have not given birth because of the high amounts of estrogen that cycle throughout the body.
There are three types of breast cancer. The first type of breast cancer is estrogen positive. It is found when an estrogen receptor is identified on the tumor. Estrogen positive cancer treatments are usually easier, with surgery and hormone blockers being the main procedure. If someone has estrogen positive breast cancer, avoiding deep fried and processed foods is recommended. The second type is HER2 positive breast cancer. It is when the breast cancer tests positive for a protein called human epidermal growth factor receptor 2. This protein promotes the growth of cancerous cells. Treatments for this cancer type can include chemotherapy, surgery, and/or radiation, with chemotherapy being the first procedure. The last type of breast cancer is triple negative breast cancer. This accounts for about 10 to 15% of all breast cancers. The term triple negative breast cancer refers to the fact that cancer cells don't have estrogen or progesterone receptors and also don't make any or too much of the protein called HER2. This cancer type has a high chance of recurrence, and common treatments start with chemotherapy, then use a combination of surgery, hormone blockers, and radiation. Importance of screenings. The most important method of prevention for breast cancer is early detection or screenings. Breast cancer screening aims to detect cancerous cells during early stages. Based on these results, patients can be offered curative medicine or an operation that can rid the body of cancer. The recommended screening test for breast cancer is a yearly mammogram, starting at the age 40 for most women. This exam identifies abnormalities in the breast tissue that would prompt the patient for further testing, such as ultrasound and biopsy. Having a first-degree relative, such as a mom, sister, or daughter, with breast cancer significantly increases chances of getting breast cancer. People with higher risk factors should be tested more regularly. Studies have shown that women who regularly get mammograms have a lower chance of having to do aggressive cancer treatment like mastectomy or chemotherapy.
Our fundraiser with Emory. We have partnered with Emory to create a fundraiser for breast cancer awareness. All these funds will go to Emory to invest in breast cancer research and improve their treatment. Here we have a QR code which takes you to our very own Emory fundraising page. On that page, we have written a brief introduction and included a donation form where people can support our campaign. We have a goal of raising $2,500, and so far we are about halfway there. Our social medias. We have many social medias, including our Instagram, Facebook, and YouTube. On our Instagram and Facebook, we post infographics, flyers, and other posts on breast cancer. On our YouTube channel, we have posted an interview with Dr. Khan, and this presentation will also be added. So please follow us on these for more information. Thank you, everyone, for joining on such short notice. I hope you enjoyed your presentation on breast cancer.